Greg Olson, Director of the New York State Office for the Aging.
Good afternoon, everybody. My name is Greg Olson, and I'm the Director of the New York State Office for Aging. Thanks for joining us today, and I'm really looking forward to this great show. Today, we're excited to continue our discussion about legal cannabis in New York State. Our guests are certainly no stranger to the show, and certainly no stranger to this issue. So I'm really thrilled to have back with me today our friends Dr. June Chin, and she's with New York State Office of Cannabis Management, and Dr. Kenneth Weinberg of Cannabis Doctors of New York. So I want to welcome you both, and thanks for joining us. I think they'll be pulled in a second. Today, we're going to cover this topic from a little bit of a different angle. So we've done a couple of shows on the health benefits of considering medical cannabis. And so we have those shows posted if you want some more information on that topic. But we're going to cover a little different angle today. Medicare, your doctor, affordability, health equity and access, medical cannabis use versus recreational use, and the latest in state and federal policy. And we'll probably cover a couple more things as well. But before I get started, I want to congratulate you, Dr. Chin, and New York's Office of Cannabis Management on some recent milestones, including the 5-year anniversary of the Marijuana Regulation and Taxation Act, and that's in New York State. As New York advances an equity-driven cannabis market with, listen to this, $3.3 billion in sales, more than 600 dispensaries throughout New York State, which is really an amazing milestone. So congratulations. So again, welcome again, both doctors. I'll call you the good doctors. And let's dive right into it because, you know, what we've talked about in the past is really what the benefits could be for an older adult, chronic conditions, anxiety, maybe sleep, et cetera, and having those conversations with professionals like yourself and others. But, you know, again, on the health side, let's get right into the health conversation. Why is it such an important topic right now for older adults? And why should our listeners, older adults, their families, organizations that we work with, why should they be paying attention to this issue?
I think that's a great place to start. And the honest answer is that older adults are already leading this conversation. We're seeing more and more patients in their 60s, 70s, 80s asking about doctors about cannabis for things like chronic pain, poor sleep, anxiety, even side effects of other medications. Because as you know, older adults are on multiple medications.
I'm going to get out because I can't.
As well as vitamins, for example. So the curiosity is there, right? But what we've been missing is the guidance. So at the same time, the science is maturing, research is growing, state programs such as ours have expanded access. But yet many older adults still feel like they have to figure this out on their own, quietly, without bringing it into their regular healthcare provider. So that's the gap that the Office of the Cannabis Management is here to close. This conversation matters because older adults deserve to have accurate, safe, and compassionate guidance from their trusted providers.
Science has advanced because it can be very, very beneficial. But getting the correct education and outreach and destigmatizing this issue is really, really important. I mean, you know, when you're growing up in the 40s, 50s, and 60s, the 1940s, 50s, and 60s, you know, the myth about what cannabis or marijuana was is really different than what it is today. And the advancement has been tremendous, which is why, again, we love partnering with the two of you and others to get out in the community, have us send some messaging, have you guys do the education so that people can get a handle that, hey, this is something worthwhile for me to consider and to have a further conversation. So, you know, Dr. Chin, a lot of older adults assume, and it may be correct, maybe not, I'm sure you'll answer this question, that Medicare won't touch anything related to cannabis. First and foremost, is that actually true, or is there more flexibility than people might realize?
Well, Greg, this is probably the single most common misconception I hear, and it stops people from getting care they're already entitled to. So let me be very clear. Medicare does not cover the medical cannabis product itself, but it absolutely does cover the doctor's visit. So if your physician accepts Medicare, they can bill you for a routine office consultation, just like they would normally if for a diabetes checkup or for your wellness check, your annual check for your colonoscopy. For example, this visit can include a full conversation about cannabis, your symptoms, your medications, and whether or not cannabis might be appropriate for you. So you don't need a separate cannabis clinic. You don't need to pay out of pocket for a special provider. The coverage you already have, the insurance coverage you already have, can support this conversation.
That's great. And Dr. Weinberg, I know some of the answer, but I'm really interested in this follow-up because, we were talking, I know you had a little tech problem, but we were talking about how important the outreach and education is, around this issue, what the benefits are, trying to destigmatize it. And, we've partnered with you and others to get you in front of some of the folks that we serve, our naturally occurring retirement communities, which we have all over the state. But, from your perspective, are groups and facilities that are representing older adults coming on board more interested in, getting the type of education that we're all so desperately trying to get out there in order to help older adults the best that we can?
Yeah, it's been a very slow process, Greg. It's interesting. I started with one adult living facility in Manhattan 5 or 6 years ago. I'm now at 3 or 4 in Manhattan. I just gave a talk to Brookdale Senior Living up in East Niskayuna. That whole organization is now on board, which is very exciting because they have 20 plus facilities across the state. So it little by little it's happening. I mean, I think all of us, June, with the OCM and me and other practitioners are just trying to get the word out to people and destigmatize it. And I don't know if Dr. Chin had mentioned, but the elderly are the fastest growing group that are using cannabis. They need to know about it. And it can be so beneficial for them. So I'm really happy that little by little I'm seeing progress. The trend is positive.
Yeah, and we're going to continue to assist with that. You guys are a wealth of knowledge, and I think coming from the lens, both of you being medical professionals, really put some oomph behind the education and outreach on the safety and the efficacy. We talked a little bit about, or Dr. Chin did actually, Medicare may not cover the product specifically, but obviously the annual wellness visits, it covers your doctor's appointments. Is that true for all insurance in terms of, if somebody is interested in having this conversation, whether it's private insurance, Medicare, or Medicaid, that's the venue really to raise, the question?
Well, I can tell you what I do in my practice, and I'm just a consultant really. So I'm seeing people after their primary care or their specialist has seen them, done all the testing, diagnosed them, and I'm seeing them for a consultation. And what I will do is I will give them a super bill, and it will say, for example, fibromyalgia, autoimmune disease, whatever, with the ICD-10 code, which they then can submit for reimbursement. I mean, that's the way we sort of get around this issue.
Dr. Chen, did you want to comment on that?
Yeah, exactly right. So bringing this up with your doctor is no different, again, from mentioning, your vitamin and herbal supplement, over-the-counter sleep aid, or does this interact with my other medications? A lot of patients will ask me, does this jeopardize my Medicare or Medicaid benefits, my existing ones, or would my PPO cover it, or United Healthcare, Blue Cross Blue Shield? So you can ask this for any physician that's in your network. And what Dr. Weinberg does is he's an out-of-network provider. So he provides you with the super bill, and then you'll submit the claim form yourself. And depending on your plan, you may or may not get reimbursement. But this what I always encourage patients is to make sure that your care team, your entire internal care team knows what you're taking or considering, because they know your health the best. They can help you avoid dangerous drug interactions. They might adjust your care plan if needed. If they've been your doctor for a long time, they might know, you know what, you live alone. You need to make sure that you're taking this apart from your other medications, because if you get up in the middle of the night to use the restroom, you might fall. So these are the things that your care plan and your care physician will take care of, because they understand all the other medications that come into play.
And I will just say that as the consultant, I make an effort to really talk to every one of the physicians who are involved, the psychiatrists, primary care doctors. I think it's part of the education process on both sides. And so I try to work with them. I think it's really critically important. I'll see a number of patients who are on, especially the dementia patients, who are on a variety of psychotropics. Everybody wants to get them off them. So I think it's important for me to work with those practitioners and say, okay, let's start with this. We'll introduce cannabis and then gradually try to wean them off the Seroquel or Trazodone or whatever, or the benzodiazepines. And I think it has to be a group effort.
Absolutely.
Yeah, I think one of the things, I think that you both talked about is having that conversation with your doctor. Dr. Weinberg, what you also just talked about is, that the education is not just on the consumer side, it's also on the medical professional side. So if somebody does take the quote unquote risk to raise this with their physician, but their physician is not on board for whatever reason, what do the two of you recommend that person do? Do they call you directly? I know there's a lot of physicians like you out there that are experts in this area that can provide that advice and guidance. But what if you run into a roadblock, or even sometimes you get that vibe that your doctor's not digging the conversation? What does somebody do if they want to further the conversation in a safe area if they don't feel that that's safe?
I mean, I suspect that Dr. Chin did this when she was more, seeing patients in practice. I really try to reach out to those physicians. I think it's so important. I've had a number of them. I had one physician who said, oh, he was a pain management doctor. The New York state law says you can't get opioids and cannabis, which was exactly the opposite of the way the laws were written. And I said, no, please, that's ridiculous. And we need to work together. And the guy backed off and it worked out. But I think really that outreach is so important to at least make the attempt.
Yeah, absolutely. Dr. Chen, what advice would you give to an older adult that might get blocked or not feel like they're being heard by their physician's assistant?
I would say, if possible, just like Dr. Weinberg said, get the entire care team with your potential integrative cannabis physician. So, for example, like Dr. Weinberg, all together in a call, and then also perhaps caregivers you have at home, right? So that it can be a concerted effort. Perhaps the primary care doctor doesn't understand the safety of medical cannabis and how it interacts with their current medications. Perhaps it's just stigma, right? It could just come boil down to stigma. Or they might say, it's there's not enough studies. So talking to an expert like Dr. Weinberg will help quell some of the concerns that the other clinician would have.
Excellent. One of it's not one of the Governor Hochul's priorities since she took office has really been around affordability. And we're seeing, gas prices up $1.20 a gallon, second highest auto insurance rates in the country, rent, food, co-pays, medication, and it's really hard on a fixed income anyway. It is really, really difficult now. I don't think it's a stretch to say that a cannabis care option can actually help with affordability and serving people who are on fixed incomes who are trying to stretch their dollars. Agree or disagree?
No, I'm sure Dr. Chin would agree. No, I think it really can help. If you think about the prices that people are paying for a lot of their drugs, cannabis is vastly cheaper. and oftentimes can take over many of the needs that patients have with other medications. But go ahead, June.
I'll play the devil's advocate because this is something I feel about deeply, but I do see oftentimes prescription medication copays are less expensive than paying out of pocket for medical cannabis. I see the financial stress that older adults are carrying every single day, especially when you're thinking about alternative medicine. You might say, I want to try acupuncture or massage, plant-based medicine. A lot of that is out of pocket. When you're using Medicare to pay for the visit you're already having, that will help you save on financial resources, right? Because you're talking to your existing doctor, and they can bill your Medicare insurance. But also, when you get to the medical cannabis dispensary, you can let them know you're on Medicare. And a lot of those medical cannabis dispensaries will give older patients a discount. And you can, there's home grow. There's a home grow program, which helps patients make their own medicine, grow, be empowered with the relationship between themselves and the medicine that they're taking. And they can create tinctures on their own. They can get into baking and cooking and infusing butter. So there are different ways to make cannabis much more affordable.
Yeah, and again, just building on some of the things you guys are talking about earlier, if you're able to come off of certain medications, obviously that's going to be a savings. But also, if you're feeling better and you're managing your chronic conditions better, through the use of cannabis, that's going to lead to less healthcare, which means less copays, premiums, and deductibles in hospitals, physicians' offices, and emergency rooms. So certainly that can build up over time. So there is an affordability piece to this, as you guys had described. I appreciate that. We're going to take a quick break, and we're going to come back and keep this conversation flowing. We just left March. It only feels like it was a day ago. It's hard to believe it's midway through April already. But March is National Nutrition Month across the country, and in our state, we really highlight 4 portions of our nutrition program: home delivered meals and congregate meals, nutrition education, and nutrition counseling. And we oversee the largest nutrition program in the country, serving about 22 million meals to 260,000 people every single day. So we want you to take a look at this. And I want to thank LifePath right here in Albany for allowing us in their kitchen. I was telling somebody just a couple days ago, I've been traveling and working with older adults for 35 years. I have probably had hundreds and hundreds of meals in a congregate meal site, just like what you saw there. And I've never had a bad one. That is honest to God. And I want to call out Gina Cantanucci-Mitchell from Washington County, who made encrusted scrod when we went on our visit. We went to Washington and to Cooperstown, Otsego County, and it was the best lunch that I've had in a long time. So thanks, Gina. Well, welcome back. Today we're again with Dr. June Chin with the New York State Office of Cannabis Management and Dr. Kenneth Weinberg of Cannabis Doctors of New York. So let's get into a question regarding somebody's cognition. If there's a concern among families about a loved one's cognitive issues, are there tests available to sort that out, Dr. Weinberg?
Yeah, and I was thinking about this. I think, there are actually home tests if a family or caregivers are concerned about someone, and you can do that as a screening. But I think really, if there are concerns about someone's cognition faltering, that you should see your primary care doctor, and they can do a whole workup, because I think people need to understand, while 60 to 80% of the causes of dementia in this country certainly are from Alzheimer's disease, there are so many other conditions that could act as if mimic dementia, medical conditions that can actually be helped if they are looked for. So I think, a good internist or primary care doctor can do a workup with blood tests. If they suspect it, they can be doing cognitive tests. There are new blood tests that are actually looking at the tau proteins and amyloid that seem to be causing dementia, Alzheimer's disease. I just read about a skin biopsy test where they can actually take skin, grow the fibroblasts into neurons, and see if they show characteristics of the problems that will occur in dementia. So they're FDA approved now. It's interesting. So there are some tests, an array of tests in addition to neuroimaging, things like that. So there's a whole stepwise kind of process that I think people should be aware of and begin if they're concerned.
Yeah, I think the last thing, and I really liked that question. It's not a cannabis question, but why I like that question is the advancements that have been made in treatment for dementia, if it's caught early, can really be positively impactful. And so, I think a lot of folks think that Alzheimer's disease is a normal process of aging. It absolutely is not. And there are ways to reduce significantly your risks of getting dementia, such as eating well, exercising, getting your hearing checked, staying socially engaged, and not being isolated. Those types of things are things we all can do to limit our risk. But the early identification, we have a partnership with SUNY Upstate, Syracuse, and 7 of our area agencies to do the mini cog, because to your point, we work really closely with the Alzheimer's Association, and they've told me over and over again, to your point, Dr. Weinberg, that there's over 70 conditions or symptoms that can mimic dementia that have nothing to do with dementia. It could be a UTI, it could be alcohol use, it could be multiple prescription drugs, dehydration, right? So I don't think we want to put our heads in the sand if there's some memory loss, because it might not be dementia. You could get that, the test workup that you talked about and actually solve it. But if it is the beginning stages of potentially dementia, then there's these other things you can do. Get referred to one of our Alzheimer's centers of excellence and start an earlier path so that you can significantly delay the progress of the disease. So, guys, there's different terms out there. There's medical cannabis. There's adult use cannabis. Are those the same things? What's the difference? Why multiple terminologies?
Well, in New York, both medical and adult use cannabis are tested for safety. So neither is unregulated. But the difference is that medical products have tighter limits on things like yeast, mold, bacteria, which matters for patients with weaker immune systems, right? Especially older patients. And medical products don't have potency caps, which gives clinicians more flexibility to tailor their dosing for serious conditions. So it's really about precision and clinical use. When I think about, medical cannabis, adult use cannabis, they're not exactly the same thing. The difference genuinely matters, especially for our older adults with complex health needs. Again, because medical cannabis involves a healthcare provider in the process. You get your certification for that specific medical condition. Your care is documented. Ideally, it becomes part of that coordinated care plan. And there's clinical oversight. When you get to the medical cannabis dispensary, you see a pharmacist, and that pharmacist will look over your medications once again and review the course of action with your clinician's guidance, when to take the medicine. So there's this added guardrail, and that's super, super important for our older adults.
Yeah, and I think, our collective advice, well, it's your advice that I'm going to reiterate, is we don't want people cutting corners and going right to the dispensary without having a conversation with people like yourselves, without having that check-in, without having the care team kind of weighing in, because it's important, as you said, Dr. Chin, dosages, safety, when to take it, having a pharmacist review, those things are all really, really important. So for the population we're trying to serve, don't just pull into a dispensary. Have the conversation with, starting with your primary care physician first. Dr. Chin, I know that New York State has amended the original medical cannabis law. From your perspective and maybe what patients or individuals need to know, what are some of the changes that were made that really stand out to you?
Well, what stands out to be the most is that this legislation was clearly written with real patients in mind. Certifications can now last up to 2 years, which is a meaningful change, especially for older adults who have mobility challenges, or they might find it burdensome to see the clinician again. Maybe they're using accessoride, or they have to coordinate with their caregivers to make that doctor appointment. So that 2-year certification really makes a difference. I mentioned earlier, patients now have the option to cultivate at home. We have expanded home grow, which gives lower income patients a path to affordability. So it doesn't depend on pricing at the dispensary. We also have reciprocity. Sometimes patients come from out of state. Maybe they're coming in to go to Memorial Sloan Kettering or to a specialty hospital here, or for tourism, for visiting family and friends. This means that someone traveling to New York who's a medical cannabis patient at another state does not have to interrupt their care. So these changes remove real barriers. And so when you add them up, you really get a program that's modernized, that's more accessible and more equitable.
Can you talked about other states, so kind of, begs the question about what's happening at the federal level. So there's a lot of states that are doing what New York is doing. There's a lot of states that just clearly aren't. Is there any movement at the federal level with FDA or others to, kind of make a uniform national standard for states?
Right. So state level reforms like ours in New York are doing the work that the federal policy has not caught up yet, right? So I know this administration has been talking about rescheduling when it comes to cannabis at the federal level. And what that means is, if cannabis, sits in the federal government as a list of controlled substances, right now cannabis is classified as a Schedule I drug, right? That's the most restrictive category, which is reserved for substances with no accepted medical use and high potential for abuse. But if rescheduling happens, it would move it to a lower category like Schedule III. So this acknowledges that it does have legitimate medical applications. So for our older adults, I would say the practical impact wouldn't be immediate. So you wouldn't wake up the next day and find cannabis covered by Medicare. But what it does mean is over time, more research, better guidelines, and then clinicians, so healthcare providers feeling more comfortable discussing it, which is a stronger pathway towards potential insurance coverage. So it also changes the culture, right? When the federal government formally recognizes cannabis as medicine, it gives patients and providers alike that permission to take it seriously, to integrate it more into healthcare rather than keeping it at arm's length.
Yeah, no, that's important. Thank you for clarifying that. Let's talk again about affordability, but let's talk about prices. Cannabis prices have come down quite a bit over time. I'm not going to say, at least, when I was in high school, X number of years ago, right, what somebody would potentially pay versus now, it's about a quarter. It's 75% cheaper now. How does the shift in cost, though, actually change who can access it and how people decide whether or not they want to try?
Yeah, pricing has been one of the most significant access barriers. It has come down. So a lot more patients on fixed incomes can try it and can afford it. And like you mentioned earlier, when we see these lower product prices, and older patients can sleep better. That means in the morning they can get up and they can go for that walk, and maybe they don't have to go to physical therapy as much, and they're saving on that. You mentioned, memory loss. If you sleep better and you eat better and your mood is uplifted, right? That also affects your memory, right? That'll improve your memory and your quality of life. So overall, if you look at it from a holistic view, it increases your access to better healthcare.
Excellent. Let's talk about the importance of storage and safety. I've unfortunately, and I'll kind of apply this to older adults in a second, but I've read way too many horror stories of children getting into their parents, gummies. They look like gummy bears, right? And the impact, for older adults, there's almost 200,000 that are primary caregivers for their grandchildren. And whether you're the primary caregiver or not, many older adults obviously live in families and have kids, grandkids, and great grandkids. So talk about why it's really important, especially the way they look. If it's not, it could be a candy bar. Who doesn't want a candy bar when you're, 3, 4, 5, 6 years old, or a gummy bear or whatever? But just really talk about why it's so important for safety and storage.
Well, this is an issue that doesn't really get enough attention, and the data is alarming. We have seen a dramatic rise in accidental cannabis exposures in young children, including infants and toddlers, especially as cannabis becomes more widely and available at homes. Grandma, grandpa might leave it in the dining table or the dresser, and a toddler gets into it. But I do want to point out that in the regulated dispensaries, in our dispensaries, it is child-proof, right? So they're child-proof products. The products do not look like Doritos or Oreos or candy bars. We have strict regulation on packaging and labeling as well. So the important thing, the take-home message, is edible products of all kinds that are attractive to children that can be left out can cause serious harm. So you make sure you lock it away, you put it out of sight from pets and from kids. There are lock bags that you can purchase. For grandparents and older adults, sometimes they don't realize, a grandchild's coming and visiting. So you have to make it a habit to always put away the medication, just like you would with prescription medication, right? Especially if you're in a multi-general household, right? This is a real and immediate responsibility.
Yeah, I mean, you just can't leave that stuff, this or any other type of medication laying around. And unfortunately, a lot of people still do that. You both talked about, especially at the federal level, research and, putting the validity behind cannabis as medicine. Hopefully the feds will, take some steps on the rescheduling. But can you talk a little bit about what kind of research that you're aware of that's being done right now for cannabis in older adults? I mean, I did a lot of work years ago on prescriptions, and a lot of the prescriptions that older adults take were never actually tested or tried with older people. So if you could talk a little bit about what kind of research is being done, and is it condition specific, like they're trying things with dementia or other types of chronic conditions that might affect older adults more?
Well, I can specifically talk about work that I'm doing at Northwell. We have a medical cannabis research group there, and we just got approved. We got a grant from Northwell to do a pilot study that's going to build on work that I'll just mention. Bonnie Goldstein, who's a pediatrician in LA, who has been treating kids with autism for years, and she did work with when there are interactions in the endocannabinoid system, there are byproducts, these peptides and different chemicals that appear in the saliva, very specific to those interactions. And Bonnie did a study where she gave the kids, she took their saliva at 0 time, gave them cannabis then, and did tests of the saliva over the period of the day. They used AI, and they were able to tell Bonnie, okay, this kid, allowed her to personalize the medication for each of these kids. This kid needs X amount of THC, X amount of CBG every 8 hours. We believe, because there are a lot of similarities in not just the biomarkers, but behaviors in kids with dementia and patients with kids with autism and patients with dementia, we are going to be looking at those same biomarkers in the hopes that we will be, when I see or Dr. Chin sees a patient with dementia, we can say, you know what, we're going to do a salivary sample, and then we will be able to tell you exactly what products you need. And I think there's another study that the same group I'm working with is doing with migraines out in Buffalo. So it could be used for any of the conditions that we see that we're using cannabis to treat for. And it's very exciting.
That is, that's amazing. Absolutely amazing. Dr. Chin, tell me what the Center of Excellence for Cannabis Care and Health Equity is.
Yes, so exciting. So the Governor Hochul announced this in her State of the State in January. It's an agency initiative designed to do something that has long been needed: give healthcare providers the education, the tools, and the support they need to have these cannabis conversations well. So right now, patients are bringing cannabis conversation into the exam room, but unfortunately, a lot of clinicians don't know what to do at that moment. So the Center of Excellence is designed to do that. We are building simple tools, clinical tools, training, guidelines, support for hospitals, community clinics, so that providers can focus on what matters most: having that conversation about safe storage, reducing risks like drug interactions or ED visits, and helping patients make informed decisions. So we're working in coordination with our sibling health agencies, the DOH, OASIS, and OMH. We develop educational resources for our clinicians, our public health leaders, practical toolkits for clinical settings, and to make sure that they're documenting this well and billing it within the existing Medicare frameworks. So this is direct support for hospitals and senior care facilities, community health centers, but the focus is on safety, education, and health equity.
It's going to be a game changer. And I love the cross systems approach to this, because we were talking earlier in the show. The recommendation is start with your primary care physician. Well, if your primary care physician is not up to speed and educated on this, then you've lost before you started. So I love what you're doing here. Before we wrap up, we're gonna take another break and then get to some audience questions. But for the two of you, I always like to leave it open-ended. If there's any other thing that I didn't ask you that you want to say, or something that you said already that you really want to reiterate, I'll give you the open floor to do that now. Either one of you. And if you don't, that's okay too.
No, I think there are so many things that are going on with this. Hopefully it will be descheduled or rescheduled, because we really need the research. We need to be able to talk to our colleagues and politicians and the community and say, look, here is data. This is what's going on, which is very important. So things are happening, and I was an emergency physician for 32 years. This has been so much more gratifying for me, the work that I've been doing for the last 10 or 11 years. And I think people need to be aware of it. It is, especially medically, it can be a really such a beneficial product for people if it's done correctly.
Mm-hmm.
I would say when I was in private practice, it was so common when I had a call from a patient, or a patient even came to see me in the office, that they would whisper, can you tell me about medical cannabis? and it was, and I could feel the stigma and I could feel the hesitation. So I would say the take-home message is, for every listener, for every older adult, for every caregiver that's supporting older adults, you don't have to go outside the system to get good care. You don't have to figure out this alone, or feel embarrassed about asking something that perhaps your body needs. So your clinician really should respect your wishes and have a very thorough conversation about what medical cannabis can mean for you. Why do you feel like you need medical cannabis? Perhaps the other medications aren't serving you. Perhaps you need additional testing. Perhaps you need a sleep study. Perhaps, the list can go on and on. But this conversation you should not put off with your doctor, with your family, with yourself. It's a conversation that's worth having.
Yeah, and there's no downside to any conversation ever, right? Awesome. I'm not trying to blow through April, but I do want to highlight May, because May is a big month for us here at the State Office for Aging. It is Older Americans Month nationally. And literally since 1963, John F. Kennedy and every president after has signed a declaration that May is Older Americans Month. But New York, obviously, always first leading the nation. We did our first one in 1954. So long before it was recognized nationally. Each year we bring we ask our counties to nominate some really exceptional volunteers in their community. And every year we come to Albany, we bring over 100 people and their families together to really highlight the value that older adults bring to their families, to their communities, and to the people that they serve through their volunteerism. In New York State, we have almost 1 million older adult volunteers providing almost 500 million hours of service that, if you had to pay for that at the market rate, would cost $13.2 billion. So we're really excited this year on May 26th to celebrate Older New Yorkers Day. So now let's get it. Oh, there it is right there. There's our Older New Yorkers Day cover and our book of all of our honorees, which we're really excited about. And we want to thank them, all of our counties who nominated them, but all of the volunteers, whether they'll be here in person or just contributing to family, friends, and neighbor every single day in the state of New York. Let's get to some audience questions. That's the topic. There we go. Is it safe to use cannabis alongside other medications?
I think the importance of the medical program is that you're going to be talking with someone who's very well versed in because there are interactions. Absolutely. It is not a totally benign substance. It's metabolized in the liver. It interacts in so many ways. But I think the medical program, and in conjunction with the pharmacists at the dispensaries, really offers a lot of guardrails to make sure that you're minimizing any risk of interactions.
Dr. Chin?
Absolutely. The good news is that most of these interactions are manageable when a provider knows what you're taking. So you can adjust timing. You can monitor your levels of blood thinners, look at your anti-seizure medications. You can watch for early warning signs. So when you have a care team that's looking out for you, when you go fill your prescription, refill it at the medical cannabis dispensary, and the pharmacist says, oh, you're on a new medication, let's talk about this. This is the conversations that you need to have, and the medical cannabis program supports that.
Yeah, and I think, again, reiterating what you had said earlier, Dr. Chen, if you're in the medical program in New York State, a pharmacist will be looking at the medications you're taking. So that question's a really good one, but you're not on your own. There are professionals that know what they're looking for, know what they're looking at, and to your point, will help in that review to make sure that it's safe. So I love that. If you had to name the top things an older adult should know before trying cannabis, what would they be? Oh, I like that question.
I'll throw something out, and I'm sure Dr. Chin has things to say. But, I think something we haven't touched upon today, but that I think about all the time, is this plant has been around forever. I mean, you look through civilizations around the world, it has been in use for obvious reasons. It has so many benefits. And really, we're just talking, since the 1930s with the demonization of it. Other than that, it was an accepted medication. And I think people need to understand that. It really it's shown benefits forever. And people need to try to look at it in that context, I think.
Right. I would say start low and go slow. We say that all the time, especially older adults, more sensitive to cannabis than younger people. A small amount goes a long, long way, and store it safely. Treat it like a prescription medication. Lock it away out of reach of grandkids, pets, or anyone else in the home.
Yeah, you guys got me thinking when you said the plant's been around for thousands of years. I always think about who was the first one to try it. Like, one red berry is delicious and the other red berry will kill you. Somebody had to figure that out along the way. And always, you always wonder how these things, who figured it out? The coca leaf, right? Cannabis plants. It's just something I think.
Can I just tell you something? I met a guy who not only is a rabbi and a physician, but he's a mohel. And he said to me that he believes that the burning bush was a cannabis bush.
Oh, really?
So in terms of where maybe it was around even then, I don't know.
I like it. All right. For someone curious about cannabis who has never tried it, what's the very first step they should take? Well, we've said that over and over again, but go ahead and, you can never say it too many times.
Yeah, June, I mean, you were alluding to this, I think.
The very first step is to bring it up at your doctor's visit. If you've done some research beforehand, great, bring it in. If you don't know the right terminology, that's okay too. A simple question. I've been curious about cannabis for my pain, or I've heard it might help with sleep. Is that something we can talk about? And that's it. One sentence opens up a door that can change the quality of your care.
Exactly.
Yeah, and I'll just say, I've one of the things that especially older people say to me all the time is, I've heard about it, I've been recommended to it, but I don't want to get high. And I think people need to understand that within the medical program, there's so much control that we make sure you're going to get all the benefits without those psychotropic effects.
Absolutely.
So I think that's important to keep in mind.
Well, I want to thank you both again for being with me. I'm sure I think we've done 3 of these shows in the last year, and they keep evolving. So it gives us a chance to really reiterate some of the previous messages, learn some of the things that are changing. And, we'll continue to partner with you to do our best to get, education, outreach materials, safety, things of that nature out to the folks that we serve. There's over 5 million individuals over the age of 60 in the state of New York. There's 4.1 million caregivers that are providing care to a loved one. So, we have a lot of work to do, but I really appreciate you two so much for the way you deliver the message, how much you care about this issue and care about the population that certainly we care about as well. So Dr. June Chin, New York State Office of Cannabis Management, and Dr. Ken Weinberg at Cannabis Doctors of New York. I'm sure you will see them again. And I do have to say before I close that this might be the first Live with Greg in a year that our Chemung County Director, Beth Stranges, hasn't submitted a question or a positive comment on the show. So Beth, if you're out there, I challenge you to come back next time. So we're really excited. Our next show is a good friend of mine, Stuart Kaplan, from CEO of Self-Help Community Services. He has been doing a lot of research on redefining aging, combating stereotypes, embracing aging. I'm going to have him on to talk about the research and the book that he has just published to really take on some of our past misconcepted thoughts about what aging is and how we can age well, which is what we all want to do. So again, thanks everybody for joining me. As always, I want to thank our communications team, Alex, Darren, and Roger, and of course, my 2 great doctors here. Thank you guys so much, and we'll see you next time.
Live with Greg is a production of the New York State Office for the Aging Communications Bureau. Please join us next time.